Thank you, and thank you for being here today. Your presence speaks volumes. Mental health partnerships has been a vital force in transforming mental health care for the past 75 years. Founded by a group of advocates with lived experience, Mental Health Partnerships has consistently pushed for systemic change and community-based alternatives to institutionalization. We believe that mental health recovery is possible for everyone, especially when individuals are empowered by peers who have navigated similar systems. Today, we are gathered here in the heart of Philadelphia, where 1 in 4 people rely on Medicaid, not just to speak out, but to sound the alarm. This is not just a policy debate. It's personal to each of us, to our community, and especially to people living with mental health and substance use challenges. These proposed cuts would devastate lives, destabilize families, and unravel decades of progress in healthcare, public safety, and economic stability. Let's look at the facts. Medicaid covers 3 million Pennsylvanians, and this includes children, working parents, people with disabilities, older adults, and those facing behavioral health challenges. And thanks to Medicaid expansion, 750,000 more Pennsylvanians got care over a decade ago, and we all benefited from that. In Philadelphia, expansion brought over $1 billion in economic growth. And across the state, uncompensated hospital care dropped nearly 28%, even as overall costs rose. That's what Medicaid does. It keeps hospitals open, providers paid, and people connected to care. But all of this is now at risk, and mental health and addiction service would be among the first to go. Medicaid is the largest payer of behavioral health care, covering 1 in 4 people with serious mental health issues and 1 in 3 with opioid use disorder. Cutting these services does not just strain systems, it literally will cost lives in more overdoses, more psychiatric emergencies, more incarceration and homelessness, and more families devastated by preventable loss. Then there are the so-called work requirements, bureaucratic traps that would hit people with behavioral health challenges the hardest. Most people on Medicaid are already working, caregiving, studying, or living with serious health conditions. But for people with mental health or substance use challenges, these rules are particularly harmful. Some don't have a stable address. Others are facing cognitive or emotional hurdles that make it hard to complete paperwork or navigate confusing systems. These aren't minor inconveniences. They are true barriers. People won't lose coverage because they're unwilling to work. They'll lose coverage because they missed a form, they didn't have internet access, or they were focused on matters related to survival. For someone in recovery, losing coverage isn't just unfair, it is dangerous and it can be deadly. Under the proposed federal changes, 1 in 3 penny enrollees could lose coverage, and 1 in 4 working age adults on Medicaid could be cut off. And Pennsylvania would face a minimum $605 million shortfall, and that is just to cover the rise in uncompensated care. Let's be clear, cutting Medicaid does not save money. It shifts the cost. It pushes people into ERs, jails, shelters, and foster care. Those systems aren't just more expensive, they're more harmful, they're less effective, and they're morally unacceptable. And the public agrees. 72% of voters across parties support Medicaid. A bipartisan majority says protect it. It's not about politics, it's about people. It's about the young adult managing bipolar disorder who stays stable because of Medicaid. It's about the certified peer specialist whose own recovery journey helps others because Medicaid funds their role. It's about the parent navigating their child's mental health crisis who finds help in a Medicaid-funded mobile crisis team, not in handcuffs and not in the ER. And it's about all of us, because when people lose coverage, we pay the price in crowded ERs, rising premiums, and preventable suffering. And none of us is immune to life's challenges. Healthcare must be there when we need it most. Think about what you would want for someone you love. Today we are at a crossroads in this country, and we call on elected officials in Pennsylvania and in Washington, fight for your constituents, protect Medicaid, and reject these harmful cuts. Because a society that claims to value life, justice, and opportunity, that society does not balance budgets by sacrificing the lives and the dignity of those who need care most. Thank you.